First of all, I want to welcome all of you to this distinguished lecture series at UCA. Many of you are here from the nonprofit sector, and you know how difficult it is to fundraise in this environment and to deal with the idea of philanthropy. Unfortunately, we all have experienced that there aren't enough incentives for donors from the government or for tax reasons. And so one of the reasons why we wanted this topic in the lecture was to see how we can encourage people to get into private-public partnerships, because this is really something that will have to be done if this country is going to develop, because you cannot rely on the government for everything, particularly governments that are struggling with so many priorities. And so the social sector is the one that is always sacrificed and receives the least amount of attention. So I'm hoping that today's presentation will address some of these issues and encourage us who are in the nonprofit sector how we can go about creating change. And so what this lecture is all about. We're very fortunate to have such a chief guest here tonight. I'm not going to go into her details. In fact, I would like to request our chairman of the board, Dr. Shams Qasim Laka, to introduce our distinguished lecturer. Yeah.
That should do. Thank you. Thank you very much, Nasir. Good afternoon, everyone. It's such a pleasure to see all of you here on a Saturday afternoon. But I'm not surprised that you are here, because we have a remarkable speaker, a remarkable human being, I would say, more than a speaker. Someone whom I have known for a long time, and I have had the pride of seeing her move into different areas, and way to go still. The university has had many eminent speakers. I think we can say today is one of the most eminent ones who we are fortunate to listen to. And I wanted to mention a little bit, give you a little background of Anita. Anita Zaidi and I met for the first time when she became a student in the first batch of students, class of 50 students in 1983. Remember distinctly a few students among whom them. And of course, as the years went by, she kept on showing tremendous promise. Faculty came to me and said, "We got a couple of stars and this one is one." And the interesting part was at the end of the graduation, at the end of the 5 years in medical school, she did, and she received the first gold medal of the university. Let me describe because many years out like candy. But at AKU, we decided we are going to give a gold medal to someone who has topped every subject in every year of their 5 years. So for the last 40 years, we've just given 7 or 8 gold medals. And that gold medal is worth its weight in gold, if I may say so. So she was the first recipient, and we said, well, she's going to go places, but she went much farther than we have ever anticipated or even dreamed of. So she went away. You heard the story that she had yesterday, told us that she went for a residency program. She was 11 years in the United States, but she was not just in the United States. She was at Children's Hospital of Boston. She was in Harvard Medical School. She was at Duke. And in the process, of course, her husband, whom I know her very well, they both met at AKU as medical students in the same class. They got married. And the United States, the big fruit out of that was not just their degrees and residencies and assistant professor, but they had a baby that was born then. I was one of the first persons to see that little 2-month-old baby you brought to the alumni reunion. So it was wonderful to see that. And of course, I think I took a little part in attract, particularly her husband as well. Dr. Saad Shafkat, he was the first one to move in to Pakistan. But the story is not they moved back to Pakistan. Of course, their families wanted an secret mission to persuade Anita and Saad to come back to Pakistan. Not that anybody doubted that they would not come back, but when are they coming back? Now that they have a baby and all that. So she came back, and the story she told us yesterday that when they graduated, His Highness, who was also Chancellor of AKU and UCA, he had said, I want to meet the medical students, and I only will meet with the medical graduates, not with faculty there, because faculty had a separate reception, staff and faculty had a separate reception. He said, you take me there and you introduce me to the students. I want to meet them. So as president of AKU, I did that. And I was there when he said, and the students asked him, what advice can you give us now that we have graduated? So he just, 2 seconds later, he responded, I'll give you my advice. In very humble tones, he said, in 2 words. The sentence, I'll give it to you in 2 words. Everybody said, what's advice is usually given in rolls of paper. So he said, serve Pakistan. And yesterday, you related that advice to the student. I thought it was wonderful. It really had an impact. And I spoke to some of the students afterwards. They were very moved by your speech, as were the audiences, as were the audience. And those are the reasons why we have convocations, so that we can motivate our staff, our faculty, our students. And the journey that began at AKU went on to so many different, she was professor of pediatrics, and she went to all kinds of different, and she published 200 research papers. And it's not easy in the field in which she was, which is of course pediatric maternal care, nutrition, all of these things. And I don't know how many hundreds of students you mentored. So everybody looks to you as a role model. I say this because I want to list, our students are listening and our other centers are listening online, and I want them to know that you are the person that has done it in the same way they are struggling to do whatever their careers are. So in 2013, she received a $1 million prize. It's called the Capello Children's Prize for her pioneering work in bringing health services and care to mothers and infants. And that's a big thing. And knowing her, that very year, I was remembering, you and I both were at the convocation. I received my doctorate, and you were there, and she made a very handsome donation to AKU. It made headlines in the newspapers. So here was amazing alumna who came back and contributed, not just in service, but in kind as well. And of course, then she was nominated as a Physician of the Year by MedCap in 2021. Then she was elected to the U.S. National Academy of Medicine, if I'm not mistaken. And this was then, by then she was already with the Bill and Melinda Gates Foundation. But look at the journey. And it is an amazing journey, and we are so very grateful, Anita. And we did focus on this theme because we know you are served and you are in philanthropy. So service and philanthropy. We want you to tell us, give us words of your wisdom. Thank you so much.
Thank you so much, Dr. Laka. I wasn't expecting quite that kind of an introduction, but yes, we go back 40 years, right? It's a 40-year relationship, yes. So it's wonderful to be here, and I really am just floored by all of you being here on Saturday afternoon to listen to me. You've heard already, Laka Sab asked me to talk about philanthropy and service, and it's actually a subject I love talking about because my life journey has involved starting out as a pediatrician researcher focused on service. and then now being a philanthropy executive. And so I have, I could give you a bunch of facts and figures, but I love telling stories. And so I thought I would expand on what I talked about yesterday a little bit about how philanthropy helped me and how through philanthropy, I have had the incredible privilege of being able. So, okay, lights are burning, but this is not advancing. So it's going to be maybe a tricky one. Let's give it a try. So yeah, so I have benefited so much from philanthropy in my life, and I'm going to weave that into the story that I tell today, because what that has made possible is to have the incredible privilege and good fortune of now being able to help hundreds of millions of people around the world. And I say that when I say that, I'm not exaggerating, because it really is the work that I am able to do now from the Bill Malinda Gates Foundation helps hundreds of millions of people. So that is me as a medical student at AKU. Let's see if the pointer works. Yep. This is from the yearbook. And now I have I have the privilege of being the president of the Gender Equality Division at the Bill and Melinda Gates Foundation, which through which I'm able to program somewhere between $850 and $900 million a year to benefit humanity. And children have always been central for me. And so everything starts for me with children as the North Star. How do you make the world a better place for children? They are our future. So I was so lucky that I was 18 when the Ahan University Medical College started. Okay. Just the age when I could enter Ahan University Medical College. It could have been a year later and I wouldn't have been there. I would have gone to some other medical college, Dow Medical College or whatever. So I am so incredibly grateful for that gift that His Highness gave us in Karachi. The Ahan University Medical College education, our curriculum, what we learned, it really imparted, there was a social justice imperative in our curriculum. And how did it show up in our training? We actually spent 20% of our time working in communities, solving the problems faced by the poorest. That was throughout the 5 years of medical school, time in the community, working on projects, coming up with very practical solutions to problems people face. We had a Department of Community Health Science that still is there. We learned about the Alma Ata Declaration for Health for all. So it was a very central part of what we learned. The picture on the left is actually from Orangi. This one, that's me with another medical student from our class, interviewing a woman about the problems that she faces. That picture is from 1984. It's a slum in Karachi, which was one of the sites where the AKU medical students went for training and taking care of children. So we followed the families over time. The picture on the right is my first job, which was at with the Ahan Health Service in Gilgit and Chitral. And this was working on a diarrheal disease project. Okay, something that I started working on as a medical student at AKU, diarrheal diseases and typhoid. And I talked about that a little bit yesterday, and I'll talk about that a little bit more today. But why was this year important, and why do I talk about it so much? And the picture on the left is from a place called Buni in Chitral, where there is an AKHS medical center, quite a nice one now. This was a really formative experience for me because I learned 3 things. Okay, I learned, first of all, frontline health workers, how much they do, how hard they work. We think doctors are the most important cogs in the health system. It's actually the frontline health workers. And I learned from them so much that I couldn't learn during medical school. Then I learned about the problems that people face living in isolated mountainous communities, and how resilient they are, how they deal with life stresses, how do you deal with environments of extreme scarcity. And the third thing I learned was the importance of vaccines. And that is that arrow that is, so ostensibly I was there to learn about diarrheal diseases and diarrheal disease research, but these are the things that I really learned. This is the very near where we were working in Chitral, near the Vakan corridor of Tajikistan, where there was a huge measles outbreak. And Ziba Ras, then Mohammed, was my faculty mentor. And she said, Anita, go there and give measles vaccine to those children. There was no roads. This was all hiking and going on horse. So I have done what you do in Kyrgyzstan, climb mountains with horses, with a cold box of measles vaccine. And I immunized children in this community, very remote community. And I learned how bad measles is as an infectious disease, how it kills children, and what you can do with vaccines, because as soon as the vaccines were given, the outbreak stopped. So those lessons I took with me when I went to the United States. And that was, why did I do that? I wanted to be a pediatrician, but I also wanted to learn and train in all of the things that I thought now I needed to know to be a really good pediatrician and researcher in Pakistan, where there may not be other people to tell me the kinds of people that I had access to in the United States as mentors. So I spent 3 years doing pediatrics. I did a microbiology fellowship, and that's important because guess who supported that microbiology fellowship? Khan Foundation scholarship. Okay. So I got an Khan Foundation scholarship to do microbiology for a year, just learn about how to run a lab, because I thought it would be very important if I start doing research in Pakistan, I will need to learn a lab. I'll need to learn how to do lab work. From there, and then I went on to Harvard, also a very philanthropically supported institution. And I got more grants, more scholarships from other organizations that gave me money to study, even though I kept talking about going back to Pakistan. The Pediatric Infectious Disease Society, and then there was another Warren Whitman Richardson Fellowship. So it was all supported by Philanthropy, the training in Boston. I came back to Pakistan in the year 2000 with now what I thought were a lot of skills. And I had how much, I asked this question to myself, how much did it matter to me that there was an institution to come back to, the Khan University? And it was actually a very big factor, right? There was a place where I knew I could do really good work, that I could really help people. So it was a pull, right? It was a pull to come back to Pakistan because Khan University was there. But once I got back, I had two potential career paths. Okay, I could work in the hospital and be a very fancy infectious disease doctor, and so primarily be a clinician, right? Or I could be primarily a researcher and work in communities. And when we worked in communities teaching students, AKU medical students, because that program was continued. This is a picture from Rady Goat. Right, both these pictures are from Rady Goat, a community that AKU had established as a learning site for students. On the left, you see twins after birth. They've been delivered by a dai. This is the dai. The dai is a traditional birth attendant, not a skilled birth attendant, a traditional birth attendant. They've been delivered at home, not at a hospital, and they're being taken care of on the floor, a dirt floor, right? So twins in Pakistan have a survival rate of only 25% because they don't have I'm talking about when I was back in 2003, 2004, when I was looking at this. This is also a picture of, these are both baby boys. This is a picture of a girl and a boy, twins, okay? And you can see how much the family is taking care of the boy child and not the girl child. This is when I started realizing how everything in Pakistan that we see in pediatrics, that we see as a biological issue, there is so much social underlying inequities related to gender. Of course, this girl died. So my question to myself was, do I work on these issues or do I work in the hospital and see patients in the clinics? And I was very scared because a lot of these places are quite hard to work in. They don't have good roads. There's a lot of crime. These are tough environments, violence. Um, but my heart just wanted to work with these people. So that's what I chose as my career that I would work on with. And I started writing grants and I got funding from Bill and Melinda Gates Foundation. So I was a grantee. They had a program called Saving Newborn Lives that I got a grant from to work on these kinds of issues. And again, what kept me going and what gave me courage was the frontline health workers, right? Because they were already in those environments, working in those environments, knowing those communities, knowing how to change those communities. That really, I mean, I even remember that sometimes they would just hold my hand and say, Dr. Anita, don't be scared. Don't be afraid. We will take care of you. Please keep working over here. Don't go away. So, I mean, I had not previously already realized how much frontline health workers do. This totally brought it home to me. So, newborn health and maternal health was one big focus area for me. But I was particularly interested in issues where poverty and infectious diseases intersect. Okay, so there, newborn is one big area of poverty and infections, but the other area was typhoid. Okay, and I talked about this a little bit yesterday. I thought I would say a couple of more things to sort of add flavor to the story from yesterday. That is the paper that I published with Dr. Zulfikar Bhutta. I think some of you know in this room. He was my teacher when I was a medical student. This is a picture from Bilal Colony, a research site that he had established. And it shows why children get typhoid. They don't have access to clean drinking water. So I started learning about typhoid and seeing a lot of patients with typhoid when I was a medical student, and it really made a very big impact on me, so much that I wrote my first paper on it. Okay. So typhoid was also something that the Bill and Melinda Gates Foundation was interested in. And they called it a problem of the most impoverished. Right? There was a program that they were funding called Diseases of the Most Impoverished, and we started writing for grants and getting money. And through that, I mean, I was one of the. I mean, this picture that's on the right is actually something that enteric diseases, especially a disease called rotavirus diarrhea, which is the most common cause of diarrhea in children. Bill and Melinda were very, they were young. They were just had their children, and they had thought that philanthropy was something that they would do when they were old. Okay. But they saw this write-up in New York Times on rotavirus diarrhea and on these types of, this is referring to ORS, oral rehydration salts. And they were, they understood that actually a lot of these, I mean, they were, this is a very famous story at the Gates Foundation, is that they were shocked to realize that 1 million children were dying from diarrheal disease in developing countries. And so they really accelerated their plans for philanthropy once they read that report in the New York Times, that actually we could, if we start working on philanthropy right now, we could have much more impact than if we start after we, are old and retired. So as resulting out of that, they funded a very big program called Global Enteric Multi-Center Study. Now, I was very lucky from AKU to become one of the investigators in that study. And that was also another, like when I talk about step changes in my career, this was a step change in my career because all of a sudden I was part of this global network, especially with other really famous diarrheal disease researchers from around the world and in other developing countries, where it's the first time now I'm interacting with scientists from other developing countries and, sharing lessons. south to south collaboration. How are other people working in very difficult environments? What kind of support do they have from there? I mean, nobody had support from governments, right? They were all trying to find philanthropic support for their work. Um, and so I learned a lot from the power of peers in other developing countries and how much you can learn from them. That led to, of course, the Gates Foundation getting to know me very well from this work, and it led to the next this career change that I talk about. Well, before I go there, Dr. Laka mentioned this. This is another philanthropic story. There was a gentleman entrepreneur, actually hydroponic agriculture was his area in Texas, who had had several children die as premature babies. His wife would just give birth early and the children would die. And then they finally had a child survive, a premature child, through the extensive support of nurses. And so he wanted to give back. And he started looking at, okay, what are areas around the world that have to do with newborn and who is doing good work? So he put out a call for people to send him proposals. And I sent a proposal in because I knew now what all that I was learning through research and really good, the place that I showed you the pictures from. And I wanted to put all of those ideas in practice as service to the community, right? Because they had taught me so much. How do I give back to this community by building clinics and support programs for the population there? So I applied with that idea, and out of thousands of applications, I got the money. And that led to starting up an organization that is now working in Karachi, not just in Reddy Goat, it's now expanded to all of the Kachi Abadis or slums, including some like really big ones like Gadap, Sorab Goat that you would know, where in Sorab Goat now there are 10 clinics, there are 2 maternity hospitals, all built through this work, which is has been a source of great sort of joy to me to see that happen. Yeah, coming back to that story of the global enteric multi-center study, then opening up this opportunity where the Gates Foundation reached out saying like, do you want to come and lead that team at the foundation, right? Lead that team that does the diarrheal disease work. And that was pretty hard decision because by that time I was department chair at AKU. I loved the job. There was teaching students. I loved teaching residents, fellows, establishing infectious disease programs. And my husband loves working at AKU. Dr. Laka talked about that we met at AKU. So we both have the same ethos of returning to AKU with a very good fortune that we've had in our life and the gift that AKU has given to us. So he did not want to leave AKU. He said, I can't leave AKU. I'm going to be here. So you go do this, right? So it was a very tough decision to then leave family, leave children, and go and take this on. But why did I do it? Again, it was that ethos of service because I thought I could finally do something for typhoid. So I negotiated as part of my joining the Gates Foundation that we have to revitalize the typhoid program that you're doing because you're not doing the right work. And I have better ideas and I can solve this issue. But because I know that this is a market failure for typhoid being a neglected infection in only for developing countries. Only in developing countries, 200,000 people at that time were dying of typhoid every year. And there was a solution possible, and I could just see it from my scientific knowledge that you could actually make a vaccine and get it made it very, excellent vaccine for a very low cost. And why were people not doing it? And it bothered me a lot. And I said, okay, now I have the opportunity. I'm going to go do it. Right. So that led to the thing on typhoid. Okay. So, or I skipped, did I skip a slide or maybe not? Okay. Well, so yes, we just talked about that. All right. So now what I'm going to change tack a little bit and talk about the Gates Foundation. So what people know about Bill and Melinda Gates, but not that many people know about what the Gates Foundation does. And so I'm going to talk a little bit about what we do, and then I'm happy to answer questions because I could spend a lot of time talking about what we do. So we focus on the areas of greatest need where private family-owned, philanthropy. Uh, and there are 4 missions that the Gates Foundation has. Okay, so they are ensuring that more children and young people survive and thrive, because we think that a path to prosperity starts from everyone having the opportunity for good health and good education. We focus very hard on the problems faced by the poorest people around the world. We have a particular focus on infectious diseases that affect the poorest, that are neglected, for which solutions are there, but they're not being developed because not much research is happening, because they don't affect people in the rich world. So infectious diseases is a very big area for us. And then something that would be interesting for this audience as well, we inspire people to take action to change the world, because we know that our own resources are not going to be enough to tackle all of the problems that the world faces. And so working with other philanthropies, governments, civil society, especially civil society, because civil society has the power to change, power to influence governments, change policies. So all of those. So we have a special program that's called Global Policy and Advocacy that works to inspire people to change the world. How do we do what we do? So we work with partners. We have we make grants. We are a grant making organization. Sometimes we call them investments, because we are very we co-create a lot of the work so that it is strategically aligned with the impact that we are trying to have. We take risks, because philanthropies can take risks that governments or private sector, for-profit sector cannot take, right? So we look for areas where philanthropy can have an outsized impact. And science and technology is one such area where applying the latest scientific tools to the problems of the poorest can actually result in a lot of excellent solutions. And we know that we can't do it alone. So we have to work with governments, private sector, communities, nonprofits, and individuals. We now have around 2,100 employees. We have offices around the world, several in Africa. There's an office in India. There's an office in London. There's an office in China. I think China would be the closest one to previous republic. We program around $7 billion a year, and this will rise by 2026 to $9 billion a year, because Bill and Melinda keep putting new money in. Yeah, so that's when I joined the foundation, going back to how I've navigated. This is the goal that I set for ourselves, to end diarrheal disease deaths in children under 5, and that was defined as less than 1 per 1,000 live births, and to work on the problems of enteric pathogens that affect health, and typhoid was a big one over there. So I'm going to skip the next 2 because I talked about this, but I will spend a little bit of time because I've spent a lot of my early years of the foundation accelerating the typhoid program. And this was pretty big news when we got the vaccine developed. It was in BBC, it was covered in many more times. Of course, there was a scientific publication as well. And what I was telling you yesterday, Pakistan was the first country. These are little girls that are showing their immunization card, immunized for typhoid vaccine. It's a source of great joy for me to have been able to do that. And now more than 100 million doses of this vaccine have been used around the world in many different countries, just since 2019. Yeah. Okay, so then a different type of opportunity. Bill and Melinda were increasingly concerned that we were not having the impact that we could have, or we were missing, we were leaving opportunity on the table by not thinking about gender more holistically in our work. And if you look at development, you realize soon enough, anybody who's working in development, that one of the reasons, or the main reason, that places and people don't prosper is all of the ways in which they hold women and girls back. And if you invest in women and girls, you lift up not just women and girls, you lift up their families, you lift up communities, you lift up entire society. And so the charge to me was, do you want to work on this much harder issue than vaccines? But the impact potential is just incredible. And so, so I said, okay, I'm ready. I'll do this. It's not going to be easy, and it will take a very long time. Um, and so we aligned ourselves to the SDG, the Sustainable Development Goals, Goal 5, which is a 2030 goal, realizing that in that time we'll only be able to accelerate. I mean, all of the SDGs are going to be missed, but at least we can come closer to what the goal is. And so we aligned ourselves to this. Most of our work focuses on South Asia and Sub-Saharan Africa as the areas of greatest need. But as we talk today, there are other ways of thinking about issues in other countries, especially around economic inequities that exist in many parts of the world as for women's opportunities for income. So what does the division do? So we focus on 5 things, and there's actually a 6th thing that I don't have on the slide, but I can talk about that. So we focus a lot on improving women and girls' health at every stage of their lives, starting with healthy and resilient babies. So there's a big focus on newborn health, on child health, on maternal health, on women's health, both R&D as well as catalytic support to policy change in countries to be able to improve health for mothers and babies, increase women's economic opportunity and decision-making power. More income in the hands of women is basically the goal there. Collect and analyze better data to ensure women are counted and considered in policy making. Countries often don't even realize one of the things that we've noticed when we analyze, developmental support is often that it's harmful to women. Somebody was telling me this in the discussion that we were happening today, that actually it can worsen things in the way that the loan gets implemented. So how do you avoid that? How do we increase pathways for leadership for women, strengthening positive social norms about gender equality? And then the one that I don't have on the slide is how do we increase money, resources in the sector? Because the sector is really starved of resources. A lot of the overseas development money and the philanthropies don't focus on women's issues. Okay, so now I hope that has illustrated a little bit of what's possible with philanthropy. But I've been talking about the Gates Foundation, which is one model of philanthropy. There are many models of philanthropy, and very different from family foundations, which is what we are. And when you look at the definition of philanthropy, people talk about benefiting actively, promoting human welfare, making a gift for humanitarian purposes, or an organization that's distributing or supported by funds that are set aside for humanitarian purposes. You'll see that people don't include in the definition of philanthropy institution building, right? Which is civil society institution building is critical to philanthropy, and it's a miss in the definition. So when I think about philanthropy, I think about it as actively caring for one another, either individually or through organizations and supporting organizations. And we are all here because of the gift of philanthropy. And this is as I said, AKU and UCA are both gifts from His Highness. AKU gave me a first-rate education, and it created a path for me for progress and the ability to help so many people around the world. Philanthropy plays a very big role where government capacity is limited. Okay, so philanthropy has to work with governments and civil society, but in many developing countries, governments have so many priorities. They're so stretched that philanthropy can play a very powerful role in helping those countries lift themselves out of poverty. And there's one book that I've read recently that I highly recommend. It's called Hope Over Fate, which is the biography of Fazle Hassan Abid, who founded BRAC in Bangladesh, and how he thought about philanthropy, how he thought about his role at the time of the civil war with Pakistan, when it was East Pakistan and they split off, and how their society totally collapsed, right? Separate after that civil war, and how they lifted themselves up, and how philanthropy played a role in that. It's a really powerful story, and I highly recommend reading that book. Um, Nobody in this audience, or most people in this audience, will know about TKN, right? And so philanthropy can vary. It depends on what is your ability. Can you give money? Can you give time? Can you give your knowledge? All of those are very powerful forms of philanthropy, and some people are lucky enough to be able to do all of it. Right? And so, how will you give? How will you serve? Right? Those are questions that we all should ask ourselves. And I want to end with this poem that I love, and I read it often. A Bag of Tools, it's called, and it's a very old poem, more than 100 years old, 150 years old. Isn't it strange how princes and kings and clowns that caper in sawdust rings and common people like you and me are builders for eternity? Each is given a list of rules, a shapeless mass, a bag of tools, and each must fashion. Her life is flown, a stumbling block or a stepping stone. What kind of person do you want to be? Thank you.
Thank you, Dr. Zaidi. Thank you very much. Before we open it up to questions on the floor, I want to once again thank all of you for coming. I know it's a Saturday. We've had a full house. In fact, we had to put extra chairs. So we're very grateful. Sure. Besides our distinguished guests, Dr. Anita Zaidi and our colleague Alison Hine, we have two other guests that I wanted to acknowledge and welcome. Dr. Barkat Fazil, who is the resident representative of the Arkan Development Network in Kyrgyzstan. And we're very fortunate to have the president of AKU, who you've been hearing very much about, Dr. Suleiman Shahabuddin. He joined us yesterday for the convocation, and he's here today, and just in time to see the product of it, what it's all about. The beautiful architecture or the campus. It is who you are graduating and what they do. And Dr. Zaidi is not the only one who has come back to Pakistan. If Dr. Shahabuddin will tell you that their dean of the medical college is an alumni. Their hospital administrator of the hospital is an alumni. Many other alumni have gone overseas, nursing, and so they have come back. And we are also afraid many times at UCA that you were giving them a world-class education, means, and that they will go away because they're very attractive to other people who want to then get them, and they will emigrate and they will never come back. I remember when the School of Nursing graduated its first class at AKU. In Dawn, there was a half-page advertisement to get a green card for nurses, and it was specifically targeted at AKU nurses to go to Canada and the US. Half a page ad to say that no problem, just come and apply and we will guarantee you a green card, and in good time you'll be able to get your parents and your family also over. So that was the draw. And so we were saying, how are we going to fight this now? But it worked well for all of us. So I hope that you all have questions, because really what we are trying to do and the challenges we face in philanthropy is how do we create an enabling environment where philanthropy can thrive, where people can understand the importance of it and participate. Because as you mentioned, the public-private partnership is critical to any developing country. And I would say that Kyrgyzstan has a long way to go. So if you have questions along those lines, because here is an example of a foundation that's doing $800–900 billion is what their budget is. It's an amazing amount of money. And what kind of change is it creating? And so those are areas that you might want to talk about, because you can hear it from somebody who is actually administering those funds. So we can look at it and say the power of money on the one hand, but also to see that how can your lives as nonprofit professionals, how can you motivate people to contribute and to partner in various kinds of philanthropic projects? So could we have some questions now? Anybody? Anybody online also? Yes, Boran, please. Okay.
Thank you very much for your presentation. Let me raise an example, and this is Kyrgyzstan. So, and it begs it begs the discussion of what is philanthropy. And there is something called the index of giving. And if you look at Kyrgyzstan on the index of giving, and this is the last one, it ranks 41st in the world. That's a very good position to be in. And in terms of giving money, it's 33, the 33rd. So there is a lot of generosity in the population, and I guess it resolves around self-help. What the kind of philanthropy that you are talking about is a philanthropic organization that accumulates sufficient money not to help the immediate needs, because the immediate needs of people, the society is, that's an awful lot of social cohesion to do that. But that actually fills gaps in society in a very significant way. How do you move from a society that is very generous in supporting each other to that? And what are the experiences of low-income countries in that respect? So you shouldn't be under the impression that giving is not practiced here. It is.
Yes, so giving is a basic tenet in Islam, and so I'm not surprised to hear that the Kyrgyz people are very generous. There are so many models of philanthropy. I mean, I just talked about two, the Han Development Network and the Gates Foundation, which I would classify them as strategic philanthropy. You have some human welfare in mind, and you try and promote that human welfare. But there are models that are individual, giving to help your family members and your neighbors. That's very common in Islam. There are models where what is called, it's an increasingly common actually type of philanthropy that is being practiced by women. Collaborative philanthropy, where a few women come together and say, we really care about this issue and let's do it together, right? And they all put some money in. There is a type of philanthropy now that is called trust-based philanthropy, which is you find good people who do good work and you just give them money, and you don't ask them, what it is that they're doing. You just believe in them, in their work. That's also a very powerful model. All of these are ways to fill the gaps, as you're saying, fill the gaps where government, for usually resource constrained reasons, cannot be there for every need. One of the things that and you make the point well, that, I mean, a lot of individual welfare and community welfare is focused on serving the community, your own community. And that's very important. And one should respect that. But there is also the possibility of doing more, right? Doing more than that. And in Islam, there is a lot of religious charity, and there's also, what is in the Quran, which is helping orphans, feeding the hungry. So people focus on that a lot, but they don't think about, for example, supporting education, which is such a powerful way of lifting people out of poverty, right? We don't think about that enough. And to me, like, that's the most important thing that philanthropy could do, is actually educate people. Right?
Yeah, thank you, Dr. Zaidi. I think that's a very that there's a difference between charity and philanthropy.
Mhm.
People tend to mix the two together.
That's right.
In Kyrgyzstan, there is a huge tradition, a long tradition of charity, but there isn't a tradition of philanthropy. And that is what we are trying to create. Charity is something you do short term. Philanthropy is something you do long term. So I think that that distinction is important.
Very long
Yes,
time.
right.
Yeah.
Yes, that's true. And I think the reason is because of the large Muslim population here and especially the exhortation in the Quran about helping the needy and the less fortunate is a very important motivation. Anybody else? Yes. Him and I'll come to you. Go ahead.
Public-private partnership. And we have really very good law, public-private partnership law, which was for around the 10 years. But actually, our government officials, they don't know how to use this excellent tool. And so we don't have a kind of support from the government side. As you mentioned, yeah, we are very strong giving during this, like a charity kind of thing, during Ramadan and after Ramadan, or even during COVID. Kyrgyz people did really tremendous work and supported the government. But in your experience, maybe you have that, how we should encourage, motivate our government people, like to provide, to make really good policy and to support, like philanthropy, not charity. Thank you.
So that is what it takes. That is the job of civil society, right? To educate, to be a partner with the government. So one can be all of us, each of us has different type of skills. Like some people like to protest. I'm not a protester type of person. I like to see how can I create influence with the government in a positive way so that they understand what it is that you're talking about. A lot of the vaccine work that I talked about yesterday and today was basically convincing the government, right? That now we know that this vaccine is very good, and government should make the policy to introduce it to everyone. And so it really, and I was a professor at AKU, right? I mean, so a lot of it is us taking it upon ourselves as members, educated members of civil society, to educate, to advocate for things that we think will work.
So, Anita, let me start by congratulating you on this wonderful presentation. I think your commencement speech yesterday at the convocation was inspiring, and so was this presentation today. So really, when I look at partnerships and in that context, the partnership between the Gates Foundation and the Arkham University, or broadly the AKDN, has been a wonderful partnership, and we have done some excellent work together. So clearly, you have been an architect of that partnership, and you have played a key central role in bringing AKU, AKDN, and Gates Foundation together. But what would be your assessment of the 2 or 3 key factors that allows us to build this partnership? And again, using the Gates Foundation and AKU as really an example, what would be those 2 or 3 key elements that are necessary for partnerships to develop, and for partnerships to thrive, and for partnerships to achieve the successful outcomes that the partners have set out to be?
Yes. So it's very important that it's a partnership of equals. Okay. So so AKU is a fantastic world-class institution. And so for the Gates Foundation, it's a very strong partner to work with, because they know that AKU will deliver. AKU will bring its talent, its energy, its knowledge of Pakistan and Afghanistan to bear, that they will make their point of view heard. If they think that what the Gates Foundation is saying is not correct, they will tell you that this is not the correct way of thinking, that you should, this is a better way of achieving the outcome that we both care about. So I would say that's a very important part of this, is that it's a partnership of equals. Both institutions bring value to each other. Then the second, I think, key to success is that AKU has thought very strategically about its research programs and to focus on areas of greatest need. A lot of the pictures that I was showing you and the places where we were working were established by the Ahan University, right, for as a teaching and learning sites for students, which then obviously became research sites over time. And so that infrastructure was built up and AKU invested in that infrastructure. So the investment that AKU has put into infrastructure, into governance, into research, administration, and governance and on the finance side. Like I was just in Nigeria a couple of weeks ago. I spent a week there, and Nigeria, we do a lot of work in Nigeria, and we have a very big office there, but we have not done so much research. Okay, and but they have very fantastic researchers. And so now they're trying to see how do they come up to the level of other countries like Kenya. We have a lot of work in Kenya. And one thing that they realized is that they have to invest in building their infrastructure, right? Which basically for a grantor, for a funder, is the financial oversight that your money will be used well for the purposes that it is being. So they realized that, and they were saying they were sending their people to get trained in financial management. Right? So I would say those are the main ingredients where AKU has a stellar reputation. AKDN has a stellar reputation, and it's a partner of choice in many situations.
Good. Any other questions? Yes, go ahead.
Your story is so inspiring especially for the people from developing part of the world. And so we would like to thank very much. My question is, we've seen that the beneficiaries of the projects initiated by the foundation, unfortunately, do not include countries, the founding states of UCA, Central Asia, despite the fact that if you look at Kyrgyzstan, Tajikistan, there's so many challenges that people, like with your experience, could advise on how we could go over those. And my first question is whether there is a possibility of cooperating with the foundation for our countries in the areas you spoke about at your current position. And taking into account that up to 2026, there will be increase in budget allocated, and would you consider, please?
You listen very carefully. Right.
So, second question, or?
Okay. Yeah, you can ask another one. Yes.
So yes, as Mr. Pirani has mentioned, yes, our people are very prone to help each other, and yes, the most of the help is provided is charity. So most of the people help to the most needy ones, like food and like surgeries, necessary healthcare. But we have realized that education, unfortunately, in this part of the world, I mean, we really have to raise awareness about it. Education is the key, and I'm looking at your picture, how it transformed. Yeah. So that education, and now you're standing here, and we're all honored to listen to you. And that education, I mean, we see the power of education. And in that regard, do you think there is a possibility of sharing your experience through a very practical, like if we could collaborate on the campaign of raising awareness about the importance of education, especially girls, whether we could partner with you in this part of the world, taking into account the work that's being done at the University of Central Asia. Thank you very much.
Those are two very good questions. So the first one was around what can Gates Foundation do in this part of the world. So first, I would say that actually Gates Foundation does work in this part of the world, but we work through other organizations, so you may not realize. So two examples that I would give is one, the support to Gavi. where Gates Foundation is about 15%, about $400 million a year to support to Gavi, which is the alliance that supports vaccines in developing countries. And so Kyrgyzstan, Tajikistan, the vaccines that are in the childhood programs are coming from the Gavi support. The other way is the Global Fund, which is the HIV, TB, and malaria. And so the TB program and Gates Foundation is a very big contributor to Global Fund. And Global Fund is funding Kyrgyzstan for TB, for example. It's about $30 million. But apart from that, right, can we fund directly, right, institutions in UCA? And I would say, yes, of course. And we discussed many ideas today of what could be areas of mutual interest, right? And so one of the possibilities would be in gender, like in women's economic empowerment, where UCA has very good programs that they teach entrepreneurship, etc. So we could explore over there, like what is possible. And then your second question was around raising awareness for education, and I completely agree that that's a very so I want to also say, that I'm so impressed by Kyrgyzstan, right? I mean, you have very good primary education. 90% of people are literate over here. Where I come from, we would think that is, I mean, we have 50% population illiterate still. So it's a very, I mean, that is the benefit of the former Soviet system, that the literacy and primary education, even secondary education, is for everyone. The kind of education that you're talking about is higher education and digital skills, and I saw a lot of very promising efforts that are being made by UCA in those areas as well. And some of the things that we talked about today would address that even more.
We have a lot of people watching online, and so I'd like to put one of the questions up. So many of the diseases issues in developing nations lie at the intersection with environmental stresses. Yet much of the medical research dealing with these problems still like indicators and statistical models to develop linkages instead of trying to improve process linkages. See the Gates Foundation addressing this void.
Yeah, so we actually do a lot of work in this area. It's in our agriculture team, which is very focused on climate adaptation type of work, especially with women, small women farmers, trying to understand the root causes. And that was actually the genesis of even starting the Gender Equality Division, where not only do we have our own programs, now every grant that the Gates Foundation gives has to consider gender in its thing. And because gender is intertwined with development in a way that may not be obvious, but when you really start looking at the issue, it's actually deeply intertwined in the issues of development. Even how health systems are designed, what their operating hours are, what gets charged and what's free. Gender is everywhere.
Yeah. Well, you'll be happy to know that we have a school called SAGE here, School for the Advancement of Gender Equality.
Yes.
And our director of CSI, the Civil Society Initiative that we have of UCA, present here. And this is increasingly gaining momentum now. And so we have a very dedicated cell or division, not a division, but a unit.
Yeah,
that
it's
is
really
doing
good. I mean, I was actually so impressed with the students, how they were talking about gender. I mean, they had some excellent questions for me, and I was not expecting them. So I was super impressed.
Excellent, excellent. Any other questions? Yes.
Well, thank you very much. It was very impressive that looking at your background, that you coming, like, it seems like you constantly have been learning and also sharing, giving back what you learned to the society. So my question that what should be role of civil society in cultivating a culture of philanthropy in Kyrgyzstan, changing the culture, or where we should start, or where we should focus on? Because as you know that giving is ready, there's money within the people, with some part of the people, but the point is how to change from charity to philanthropy. and what should be the role of civil society? Thank you.
So, it's a great question, and I would say it's the power of storytelling. You have to tell stories. It's stories bring alive the whole issue of how much you can do with philanthropy, how much you can change a person's life with education. Um, and the program that you have, the communication program that, I mean, the people that I talked, the students that I talked to were telling, I mean, such amazing stories about their own lives and what the work that they were doing. And so we have to find a way to become better storytellers in philanthropy in terms of what will your money do if you help in this thing, if you help this institution, if you help this organization, what's the potential impact, and bring that alive through real life examples so they can see, you know, okay, if I did this, this is what I'll be able to do. I felt very strongly, and Lakasab mentioned it a little bit, that because we were the first class of Ahan University Medical School, that we had to establish a culture of giving among the alumni, right? So that's why, although it was very, I mean, I'm not a very rich person, although I'm very privileged in what I do. I mean, it was very important to me that we establish a precedence from the alumni that giving is back to your institution is very important. Okay. So we went out of our way. We were only a class of 42 people, and we raised $500,000 as a class of 42 people to give to AKU so that the future classes knew that that is what was expected.
For those of you who are here from UCA, I really want to reiterate what Dr. Zaidi was saying. The reason they have really come back to AKU is love of the alma mater. You know, she was saying about her husband didn't want to leave because he wanted to stay at AKU. So those of us who work here need to make sure that we are instilling that love for the alma mater to our own graduates and our alumni, because other than that, without that love and that connection with us, it's very unlikely they will come back to us. So I think this is something that needs to start from the moment they arrive and not just in the final year. And that's not, in my opinion, happening very much. And we really need to upgrade that part of it to make sure that they really do care about the university. And then that connection and love is reinforced over the 5 years that they are with us. Any other questions? We have this, maybe one more now. If there's anyone else before. Okay, yes.
During these days, we had a great opportunity to talk to our donors and TKN volunteers and learn so many stories, very inspiring stories of giving to different causes, for different causes. And we know that Dr. Laha was one of the founders of Center for Philanthropy in Pakistan.
That's
And
right.
if, yes, and we now see the outcomes, yeah, and the results of how the supported individuals and different projects in Pakistan. And my question is, if we go like, yes, we're saying that philanthropy is a new notion in Kyrgyzstan, but even though like if we go ahead and try to work in this sector, will there be a possibility to invite you? I mean, to
Yes, of course.
yeah,
Yes.
refer to you for certain advices. Maybe,
Yes, of
like-
course. And I was just saying, this was only a very flying 3-day visit, and now I've made a whole list of things that I didn't get to do that I'll have to come back for.
Thank you very
Yes,
much.
Yes, thank you.
So thank you all again for coming once again. And I'd like to now turn it over to Dr. Lakha for some final words.
Thank you so much, Anita. What a wonderful and inspiring lecture. It's been a great honor for us to host you here. And I'm delighted to hear you say that there are prospects of your returning. We will do anything to make it happen. I wanted to add a couple of lines or sentences to what Anita mentioned about philanthropy. And Nora mentioned about my long association and philanthropy. We were in the same situation in Pakistan. People gave to the poor, fed the orphans, took care of it. They gave fish. They didn't teach them how to fish. And our job as a university, and frankly, when the CSI was established, our Civil Society Institute, the mission, and I really want to request you to put that mission somewhere in your, and anything you do, it is to help create a more enabling policy and administrative environment for philanthropy, for civil society in your case. So, and the governments are both helpful and they are a hindrance. If they don't understand it, they'll pass a new law and say, kill them. But if they understand it, they will kill the virus that is harmful and leave the bacteria that is able to help us. So please focus on the enabling environment for civil society. Once the civil society is established and you have various organizations, most of the countries, in most of the countries, the civil society organizations, which are often unfortunately known as NGOs, they become dependent on international aid. Now, it is all right, Gates Foundation has a different approach and is politically not involved. But there are government agencies of other governments that want to support you, and for good reason, but in the process, they want also to create an influence. It goes for any government grant that you can think of. There's no free lunch here. Some more, some less. So what we need to do is get away from total reliance on external benevolence. We want to create our own sources of philanthropy, our own people helping our own civil society organizations without going through anybody else. That's the other part of your objective. Create an awareness for philanthropy. What we have learned today, it's a very nice first step towards that understanding. But they have traveled many thousands of steps, but for us, it's a first step of understanding. So I want to really thank you for bringing this forward. And we're going to have some discussions in the next couple of days about the future of our civil society programs. How do we take it to the next stage? And I think philanthropy has to remain a part of it, central part of it. I also want to take this opportunity to, of course, welcome Barkat, Dr. Barkat Fazal. He has been extremely helpful. I want to also publicly acknowledge your support while we were doing our convocation. You and the AKDN office team were very helpful to us in smoothly working. And the comments we heard from the Minister of Education, from the Prime Minister's comments that he had sent, it was really nice to see. And this is not just here, but in other countries as well. And when we talk about philanthropy, it is not Kyrgyzstan. It is regional philanthropy. We are a regional university. Sometimes we get too focused on one country where we happen to be speaking. Tajikistan is something that must be taken into account. Kazakhstan should be taken into account. And now we are more and more in Afghanistan. And I want to emphasize that if there are programs going forward, maybe not today, maybe tomorrow, we could do some very good work. And our team is working there. We are educating a lot of students, but also women included. And you talked about the medical, the nursing and midwifery and so on. We are now we just made an arrangement for educating 100 medical students, women students who are preparing for medical education. We are giving them English lessons. Women are allowed to do medicine in Afghanistan. There is a starting point. I'm also looking at President Chabudi because he's here. He very kindly came and with Dr. Zinat also, Chabudin, and they are here and we are taking advantage of their wisdom and their connections because we want to have as much linkage we have a wonderful product of AK, a leader of AK. You, Zinat is an alumna. Yeah, she's from the nursing school, and so, and I happen to have a leg in both places, or at least a claim on both places. So we have a remarkable opportunity, and I'm addressing all of us, not just the faculty, but staff, students. We should try and get much closer together in programs and areas of research where there is commonality. There's plenty of commonality, but it's coming forward. AKU has just started a Faculty of Arts and Sciences. This is a remarkable opportunity for us to learn from their experience and maybe share ours. So I just want to say that there are so many areas of confluence, and we are looking forward, Dr. Zaidi, to your next visit and to work. It's a challenge to us that in the next few days, or whenever it is, few weeks, the graduate school and the School of Arts and Sciences, but also the SPCE, come up with some ideas on how we can promote the values that we have, but also the values that are common to the Bill and Melinda Gates Foundation. Once the values are aligned, money is not the issue. They are looking for people who can do things. We are looking for petrol in the tank. So the important point is that confluence of values is very important. Thank you so much, very much. Please give her a big welcome. Big thank you. Thank you.